Hello and welcome to Heart Magic. My name is David. I am your host. I am a aortic valve patient just like you, and I have just gone through my aortic valve surgery. So, kind of left the last video I made. I was in the hospital, and people were very nice, saying nice things. I wanted to make a video that follows up on the whole situation and gives you guys a little bit of an insight as to how I'm feeling. It's been pretty much exactly a month out. And the difference is quite remarkable, and I want to give people hope that their aortic valve surgery will come out as cleanly as mine appears to have. I think the biggest problem that I'm still facing is high blood pressure. I think part of that is due to the trauma of the surgery itself on the tissue. And I think also this has to do with the overall chemistry of my body. I need to do some fasting, and I need to get better sleep, and I'm working on my habits right now, and that's probably the biggest change. Is I'm looking at this heart valve surgery as a big reset, and the habits that I'm building from here on out, I want to keep building those, and I'm pretty I try to be as disciplined as possible. It doesn't mean I hit it every single day, but I look at every single day as a fresh chance to do the perfect day, you know what I mean? So anyway, I did my aortic valve surgery a few weeks ago at Northwestern in Chicago with Dr. Malasry, and he did a phenomenal job because he's one of the best, I would imagine one of the best in the world as far as aortic valve surgeries go. So, I walked out of there pretty cleanly. There was confusion about a certain piece of this that I guess I'll go over, and part of this ended up being sort of apparent after the surgery, as far as the way that things went down. So anyway, I did the mini thoracotomy, so I have a little cut right here, and it's still healing, but it's way better than it was. Used to hurt, the first few days it hurt a lot, first few weeks really, it hurt quite a bit, but it wasn't intolerable. The biggest pain point is there's also two little bullet holes here. That's where they drained out some of the liquid from my chest cavity, and that was painful beyond belief. That was something I was fully awake for. I don't remember the tube coming out really. I remember them putting a CPAP machine on me and me being like, "Why do you have a CPAP machine on me? Just put the little nostril thing and I'll breathe," And that was kind of funny. But but the tubes, they were pretty bad. So nothing really ultimately really hurt. I was sedated. I did an injection in my spine to help with pain, and I'm glad that I did that. And you just got to breathe a lot, in the hard parts, and it's, all things considered, it's pretty darn easy. Now granted, I'm free to do push-ups, pull-ups, everything, and I'm only 4 weeks out. That's because I did not do the breastbone being opened. I apologize that I can't give any insight as to how that goes. I know that some of you will be doing that because maybe you're doing the Ross procedure, or maybe you have a particular situation where they need to do more stuff while they're in there. But I was very thankful that all I really had going on was my bicuspid aortic valve and my root being dilated, which makes sense. And that stuff just needed to be repaired. So he went in there through the ribs, and then replaced the aortic valve, and then tightened up the root. Now, I was going in there being like, "Hey, isn't it supposed to be shrunk down to 3.5 millimeters or centimeters, I should say?" And he was like, "Well, yeah," and he was kind of being dodgy about that detail. And what I realized later was he wasn't going to know any of the exact dimensions or anything until the echo once I'm closed back up. And part of that is just because he does it by hand and feel, and just ties stuff up there, tightens it up. And he said, "I tightened it as much as I could. I put in the biggest valve possible so you could get TAVRs later, and that's it." You know what I mean? That's what the procedure was. You know what I mean? So it wasn't the kind of thing where he's getting out a ruler and being like, "Oh, it's 3.5 centimeters" kind of thing. So I think as long as and I was at they said 4.7, but I thought it was 4.6. I don't know, who knows? But let's just say 4.5. I don't know. I was definitely in the range where it was, and I'd been through a lot with endocarditis and stuff like that. So it got shrunk down to 3.8, which I'm totally cool with, and they were fine with it, and they were like, "This is great," you know. And so, great, you know what I mean. So theoretically speaking, I should never have to do an open heart surgery. They did. I mean, this is maybe not open heart. I don't know. It's it was a mini surgery, and my follow-ups are TAVRs, which are through the artery near the groin. And so they shove stuff up there and then balloon up a heart valve later on if I need it. So you can do up to 2 of those before it all needs to be replaced out. So I have an Edwards valve. These things have a long shelf life on them if you've seen the data. More future data is not out there. That's why I took the risk. And I will be one of the guinea pigs that gets to tell people how long this thing lasts. And the Edwards Resilia valves, they're treated with a special coating so that you don't get as much calcification, which just lasts overall. I feel like taking vitamin K2 with D3 is going to help also. It's going to make sure that the calcium and whatnot and the atherosclerosis isn't going to become a problem on this mechanical heart valve or a prosthetic heart valve, tissue valve. So all those things said, put together, it makes sense. It's a system. It's a system that taking this particular approach. It's not an approach that cardiologists and surgeons and hospitals are going to recommend given my age. 37. And I had been through endocarditis, and this was they were definitely just like put a mechanical valve in and like just do that. And that's what every doctor's told me. So, or they offered the Ross procedure too, which in the hands of somebody like Dr. Malaysia, I'd totally be trusting and be like, sure, you know, like let's give it a shot. But this was the approach that I wanted to do. I wanted to only have one valve to worry about, and I think the only way that I would have like been really good with getting a Ross procedure is if I did a follow-up IV of stem cells, and I feel like that would just be a very nice touch to make sure that everything heals as possible. I want to do that now, but that's kind of a complicated subject. I'll talk about stem cells another time. I've done stem cells in the past, but I need stem cells for other repairs with my brain from the stroke. So I don't want to, I'm taking it slow and not really doing anything with that. So yeah, overall, how am I feeling? I'm feeling just as weak as I was before the surgery, but I think I was weak because I haven't exercised and I was stressed. I will say that the stress of having this surgery done and over with it's dissipating. The stress is going, and I'm finding all of these little moments where I'm like, ooh, I could have been stressed about that, but I have to choose consciously not to be stressed about that anymore. And that's a real opportunity for me to just not be as stressed as I was, but it is a process to release the stress and to, you know, like a Seinfeld, serenity now, you know, you want to let go of the stress and let it be like, oh, you identify it and let it go. And that's just kind of where I'm at, like socially, emotionally. And I feel like that's a good that's the natural place that I was hoping to get to. And that because the surgery is complete, I can stop worrying when it's going to happen, how it's going to happen, who it's going to happen with. I got very lucky to have my insurance cover it out of state. I got very lucky and fortunate to have the surgeon that I wanted, to have the surgery that I wanted, and for my anatomy to be in good shape and willing to receive the surgery as well as I have. Now it becomes a matter of, oh, I'm 37, I should get in shape. And, you know, getting in shape is something that's always in season, no matter how old you are. You could be 90 and it's like you can get in shape. So I just have to do that and eat well. And I have to say I'm staying pretty consistent with it. I'm staying away from vices. I'm staying away from, and I'm eating clean and I'm sleeping better, actually. I'm going to bed at a reasonable time. And I will say I'm having trouble falling asleep, but I think that that's just because I've had such poor sleep for so long, so much stress. I'm going to bed with contentment and with ease, much more, and just like I'm in bed and like let's go to bed. So I'm finding that that extra sleep is really helping me because I can stay up all night and do lots of wacky stuff all over the world as I have. And I really just want to be able to sleep well. And I am. So it's good. So I just have to watch that when I have shows and events coming up, when I'm making appearances. I will have to make sure that I don't get too wrapped up in it. If you're a fan of my magic work, I'm opening for Penn and Teller Sunday in Indianapolis. So I hope to see you there. And I'm in the Krenner room. It's a different stage than their main stage, but yeah, their show is very specific. I can't be on their stage. I'm on a different stage, and so come and see me, and I will see you guys there. Other than that, I just want you guys to know that on the other side of surgery, if you pick your surgery well, and you just grit your teeth and go do it, there's definitely another side to this where it's you feel like less crap and you feel like things are moving along and we have made progress through not just physical progress but in our story and in our life. And that is one of the most important things, in my opinion, for people to do in general, is to keep tabs on their thread of reality. And because you can, as an adult, I've met many people from childhood to now who lose their thread of reality, and it shows. And medical problems can cause that hardcore. So you want to keep a thread of where you're going and what should be done. Now, granted, we never know everything that's going to happen, but like you got to have something to cling to, you know, that keeps you sane. So that's my my take on it. I think that doing as mild of a surgery is something that I'm hoping that more patients like myself are advocating for when they go to the doctor, when they're seeking treatment. And I'm not saying you need to be loud about it, but finding the right surgery center and finding the doctor that you want and doing the work to try to get that to happen it makes such a huge difference. You know, it was right down the street from my parents' house. I got to stay at their place and just rest and you know, kind of keep tabs on another side of my life. And it was good. You know what I mean? It was definitely something to just go. And especially after having endocarditis last year, that was an emergency. And I got through that. And if you have never been in an emergency like that, I pray you never do. But at the same time, I think that that's part of what gets people scared of doing the heart surgery is they don't know the fear that you could truly feel when you're tipping over the edge and death is like waiting for you there. The brain aneurysm that I had from the endocarditis and all that stuff, it was crazy. And I'm sure other people have lots of stories like that. I'm not the only one. Take your antibiotics when you go to the dentist. I also want to make sure that people realize that everything's gonna be okay. You know what I mean? And I wish I understood. I'm the reason that it was okay for me is because I put in the work to get the surgery that I wanted. If someone's pressuring you, the thing about the medical industry that the hospitals, when I first went and found out about this, they were rushing me to get in there to do surgery. When they find out they got a live one, they're going to try to get you on the slab and sharpen their knives and be like, "You ready?" And so you have to be I hope that you are in a position where you can take enough time to research your surgery options and find the right surgeons and whatnot to make it happen. The fact that I had to go all the way to a different city to get my treatment in the way that I wanted it to added a good 6 to 7 months of paperwork waiting on. Annoying. And people moving at the speed of a snail. You know, it was horrible to wait for certain things to get done. It was mostly the insurance doing that, and so it was. But it happened, and so you know, if you need you need to. I hope that with this project that I'm making here, whatever this thing is, still, that I'm helping patients shorten the time of needing to understand what's going on inside their bodies, with finding the right treatment for themselves, because I'm not going to treat you. I'm not here to treat you. And then also the lifestyle factor of it. If there is one thing that I could share that could help in your overall treatment, it's lifestyle stuff, the everyday stuff that really matters. And put yourself on a path where the story is so much easier than if you're frazzled trying to find all the answers. Or trying to find where you go find the answers, how to read the answers. You know, these charts that they give us with our hearts and stuff, very confusing when you're first getting in it. So I hope that this project sort of pushes that into that territory. I'm considering doing live Zoom calls. I'm considering doing sort of webinars on certain subjects. So far, this channel has been a lot of ranting. It has been a lot of, here's what's happened to me. Now that I'm actually, I'm on the other side of surgery and I've actually done it, and I've done all these other things in conjunction, I feel like I'm in a better position to just give instructions to patients, to give them the path where they need to go, to find a direction to go. So if that appeals to you, so some of these webinars may be things like how to save thousands of dollars when you have a bicuspid aortic valve on medical treatments. How to eat, exercise with bicuspid aortic valve. How to you know, find the right doctors, or here's a selection of the possible treatments that you may get that you could talk to your doctor about, or find a doctor who does X, Y, and Z. I've considered those types of things, but there is a teetering point where I feel like it gets too medical, and I'm not a surgeon, and I have to try to keep it within a certain lane. And I'm not trying to be a surgeon. I'm trying to use this channel to be a coach, to be someone who will aid in your success and understanding of what is happening to you. Because don't forget, there's a tiny little flap of skin in the epicenter of your body, and it's born deformed. What does that even mean? You know what I mean? So, I don't think that you're going to get all of the answers from the doctor. I think that they're going to give you a suite of options that kind of give you an idea. Some of them are much more thoroughly heartfelt explainers than others. Doctors out there are oftentimes not good at explaining things to patients. And it's okay for there to be somebody who may be better at explaining it, who's not in the hospital system. There are people like that who, you know, valvesurgery.com and all that stuff. There already are heart valve surgery. There's another website. There's other websites out there where patients have taken the torch of explaining to their peers what is going on and giving them those options. So if you like the idea of webinars or some sort of a class or membership website, these types of things, you know, put in the comments that you'd like to see that sort of thing, or if you want to be part of a live Zoom call. I was thinking of also maybe doing anxiety and stress for bicuspid aortic valve patients. I'm just thinking these things out loud, seeing what you guys react to. So anyway, I've got other stuff I got to do. Just want to share some updates to the story, and I hope you guys are well out there. Be sure to subscribe to the channel. Check out my other channels, my magic channel, and other stuff like that, and we'll see you guys later.